today we will see what are all the adverse effects or the side effects or the adverse drug effect. So if you ask you the question, which antibiotics are very safe, then you have to say the answer. The penicillins are the safest antimicrobial drug among all. So it may be a surprising thing to you also, but the thing is, apart from the allergy, in all aspects, penicillin are the safest antimicrobial drug when compared to the other drugs are concerned. So organ toxicity with penicillin is very, very rare, like the nephrotoxicity, the hepatotoxicity, or causing the ulcers and many more. They are very, very rare, especially in case of the penicillin. Only thing is they cause the hypersensitivity. So it is infrequent, but very serious side effect, because many times the penicillin allergy may take off the life or life threatening. Hence, the hypersensitivity, apart from hypersensitivity, it is totally safe. So it is one of the most important serious adverse effect, especially the hypersensitivity, and the major antigenic determinant. How it is called? How it is caused is determinant of the penicillin hypersensitivity is the metabolite penicillic acid. So yesterday we have seen what are all the metabolites of the penicillin. So the penicillic acid, especially here we have seen that penicillin is considered to penicillinic acid, then it is considered to penicillic acid. So it will combine with the lysine in proteins, then excreted through the urine. So this is the metabolic pathway, how penicillin is converted to penicillinic acid, then penicillic acid. So then this is also the same thing. The penicillin, under the influence of the beta-lactamase enzymes, it is going to be degraded to the penicillic acid. That is so this is the metabolite, especially of the penicillin. So penicillic acid, which reacts with the proteins and serves as a hapten. Hapten means the antigenic determinant to cause severe immune reaction ranging from the maculopapular rash to angioneurotic edema. So anaphylaxis is a rare situation, but may be a very fatal condition if it is no precaution is taken. So always it is a very mandatory to conduct the penicillin allergen test before going to give the drug. So please listen here. The penicillin allergy is not present in case of cattle because the haptens which are responsible for the allergy are not so developed, or they are absent in cattle. So in case of cattle, we can administer the penicillin without any test or allergy test. So the thing is, that's why the penicillins are most safest drugs among all in case of the cattle. So the penicillic acid and it will react with the proteins and forms a hapten to cause the immune reaction. So this type of the reaction is not present in case of the cattle. That's why you need to remember that they are the very safe drugs, especially in case of cattle and also all the domestic animals. In dogs, some of the reactions may occur, but it is very, very rare, 1 in 1,000 or 1 in 10,000. That's the frequency. So important manifestation of allergic reaction in animals, particularly cattle, may include sometimes some reactions may occur, rash, urticaria, and drug fever. Means after administration of the antimicrobial drug, the body temperature will increase. So that is called as the drug fever. And the angioedema, serum sickness, then vesiculitis, and rarely anaphylaxis is seen. So some of the allergic reactions like the urticaria, allergy, and especially in case of cattle, the first allergic reaction, the symptom will be swelling up of the eyelid. Remember that in case of cattle, the first allergy is uncomfort and swelling up of the eyeball, the eyelashes. And the cross-allergic reactions between penicillins are very well recognized because the hapten responsible for the penicillin allergy is same. So if a patient is allergic to penicillins, it is always advised to use an alternative antibiotic. So apart from penicillin, any other antibiotics may be okay because the penicillin and its derivatives, because the penicilloic acid is the metabolite of most of the penicillin. That's why the thing is we need to advise not to take the penicillin. So the symptoms of penicillin allergy are the hives, means the rashes will be present throughout the body. Then rashes will be present throughout the body. Then wheezing or the choking, especially the person will feel like the bronchitis, and there is lot of difficulty in breathing or swallowing. These are all the symptoms. And swelling in mouth and throat, both the person will feel that the tongue is swollen, and the swelling in the mouth is a common symptom in case of the human beings. And anaphylactic shock, so it becomes a very tragedy in case of human beings, and the person may die if the proper care is not taken. Then, and in such, especially on the backside of the person, a lot of rashes or allergic reactions will be seen. That's the characteristic allergic feature of the penicillins. So this is the allergy chart. Before injecting the penicillins, one should understand this particular chart. Here, please see that the beta-lactam allergy cross allergy chart is there. So avoid all beta-lactams if there is a caution that ICU admission related allergy, delayed beta-lactam allergy causing interstitial nephritis, then hepatitis, then hemolytic anemia. These are all the delayed reactions. Whereas the delayed severe skin allergic reactions like the Stevens-Johnson syndrome, then the toxic epidermal necrolysis, then exfoliative dermatitis, and also the acute generalized, then exanthemus pustulosis. So all these are present here. This color, which is the gray red, is the penicillins. All the penicillins here. These are all the penicillins. Whereas this color replicates the cephalosporins. Whereas the third generation, this is the first generation penicillins like cefadroxil, cefazolin, then cephalexin. All these are the first generation. Then second generation, third generation, and fourth generation. All these are listed here. So how we is to check is the thing is, if it is cross 1 means do not prescribe, because the same side chain clinical evidence of cross reaction will be present. Then X square means the same side chain but theoretical risk of cross reaction. There is a chance that the cross reaction may occur, and one should not prescribe here drugs. So here you can see X2, wherever the X2 is there, then it is having the similar side chain, and it should not be prescribed. X2, see here the X2, wherever the X2 are, the ampicillin, amoxicillin, they have got the similar side chain. So these should not be prescribed, especially to the that of the human beings. And the clinical evidence of cross reaction X4, X3 is also the similar side chain potential for the cross reaction. So here you can see that the ampicillin, amoxicillin, there is no issues. X1 means it should not be prescribed. Whereas the cloxacillin also, the X5 means, yes, PSK 180, what is the problem? Okay, X5 means it should not be prescribed. Whereas this tick, it says that the cefazolin safe, you can prescribe this particular thing, especially we can select these drugs. So the physicians, we should always have this particular chart, whereas the X3 should not, this is not to be prescribed, especially the piperacillin. Piperacillin should not be prescribed. So also the alpha, this beta-lactam inhibitor combination like amoxicillin, clavulinate, and piperacillin and tazobactam. Here also you can see some of the cross marks are between some of the drugs here. The combination of cefoxitin with that of the penicillin should not be done because it is not indicated. So that's why it is the thing is the such preparations are there in the market and one should not prescribe them. So whereas meropenem can be prescribed with all the drugs, suppose if it's a combination, whereas it should not be prescribed with the imipenem, etc., because it may cause theoretically risk. It may be a theoretical risk is present in that particular situation. So one should have the particular chart and be careful while prescribing the penicillins. So the apart from this one, there are certain other few reactions like the gastrointestinal disturbances may be present. See, the use of the broad spectrum penicillins may cause the GI disturbances, particularly sometimes it is diarrhea and super infections, means the apart from the regular infection, some other microorganisms may be there. So it is due to the disruption of normal balance of the GI microflora. So the penicillins are incompletely absorbed and have an extended bacterial spectrum, especially on the gastric microflora is concerned. So the ampicillin, etc., they have got the destructive effect on the normal microflora. And the penicillins are also associated with occasional nausea, vomiting, and anorexia. So occasional, not a very common sign. 1 in 1,000 or 1 in 10,000, they may get these clinical signs. Whereas the platelet dysfunction, so this is one of the thing that need to be given some attention. And some penicillin like anti-pseudomonas penicillin like the carbenicillin may cause the thrombocytopenia and decreased agglutination property. So it is generally a concern because some of the patients may have the bleeding tendency or the hemorrhage, or those receiving the anticoagulant therapy, especially some of the persons with the cardiac disease, they will always receive the anticoagulant therapy, and such persons should be careful while taking the drugs like the anti-pseudomonas penicillins like carbenicillin. Then the organ-directed toxicity means which are the organs that will be suffering from the toxicity. The penicillins are irritating to the neuronal tissues and can provoke seizures, particularly when administered at high doses or when injected intrathecally. So the penicillin should not be injected intrathecally and may cause irritation to the neurons. Then sometimes the epileptic patients may be at risk. And the very high doses or high doses may cause the neurotoxicity, particularly ataxia in case of the dogs. That means they are safe to the extent of 10 folds. But sometimes if you administer the overdose, then they may have certain ataxia. As penicillins are accumulated in the renal tissue to the extent of very high, they have a potential to cause acute interstitial nephritis, but it is rare. And the cation toxicity, the penicillins are generally administered as sodium, potassium salts, and the cation toxicity is possible if very high quantity is administered, or else it is not going to cause. The excess sodium may aggravate the CHF, congestive heart failure. Then rapid potassium penicillin administered by the fast IV route or it may precipitate hyperkalemia. So the cardiac rate may decrease because more and more potassium in the body will cause the hyperpolarization. Hence, it may cause the adverse effect on heart. So while giving the IV injection, one need to be careful. Whereas the contraindications and the precautions, in which condition it is contraindicated. So the number one contraindication is the hypersensitivity reactions, and they should not take. The second one is the high dose of the penicillin, sodium or potassium with the proper pre-existing electrolyte abnormality and also the renal disturbances or the congestive heart failure should be avoided, as they may precipitate the existing conditions. And the oral administration of penicillins is generally not recommended for shock due to the slower and impaired GI absorption, although penicillins are not teratogenic. So the oral administration is not indicated because, number one, especially in case of the acute disease, because it takes longer time to get absorbed into the circulation, and the penicillins are not teratogenic, but their use in the pregnant animal should be avoided because they may cross the placental barrier. So in the embryo, it may be having allergic reactions, hence such things should be avoided. And the drug interactions, penicillins show interactions with so many drug solutions, especially the salicylates, then phenylbutazone, then the sulfonamides, you know very well, they get displaced the penicillins from plasma protein binding site when administered concurrently. So we should not administer the sodium salicylate, the phenylbutazone, the sulfonamides along with the penicillins are concerned, because they displace and suddenly the high concentration of penicillins will be there in the body. And the probenecid and other weak organic acids, probenecid and organic acids, competitive block the tubular secretions of most of the penicillin, thereby increasing their blood concentration, and the plasma half-life will be increased. So probenecid will compete for the penicillins, while excretion in the reabsorption site. Hence, the quantity of the penicillin will be retained in the body. And the combinations of the penicillins with aminoglycosides can have the synergistic or the additive effect. So always the combination of the streptomycin with penicillin. It is a very old combination because streptopenicillin is very commonly used in case of the cattle. The streptomycin acts against gram-negative bacteria, whereas the penicillin will act on the gram-positive bacteria, and both the combination will have the synergistic or the additive effect. So the penicillins with the bacteriostatic drugs like chloramphenicol, tetracyclines and erythromycin will produce the antagonistic effect. And so they should not be administered with salicylates, phenylbutazones, sulfonamides, chloramphenicol, tetracycline and erythromycin. So these will produce the antagonistic reaction. So however, carbenicillin and ticarcillin interact chemically in aminoglycosides and should not be mixed with the in vitro, because many of the doctors do have the habit of mixing one or two injections. So this should be avoided as far as possible, because the drugs may have the different bioavailability, and also they may have the different pH, and they may have the drug interactions, and the absorption of one drug may be inhibited by the other. That's why this should be avoided. And acids susceptible penicillins like penicillin should not be mixed with the normal saline or acidic pH parenteral fluids, because the acid pH inactivates such penicillin. So the normal saline should not be mixed with the penicillin. Only the distilled water should be mixed. So many times it is a practice of the doctor that if the distilled water is not available, they are going to dilute the penicillins with the normal saline which is available in the hospital, and that should be avoided, especially in case of the penicillins, because the acidic pH of these substances inactivates the penicillins, which is having the base pH. The clinical uses of the penicillin, it is very widely used both in human and veterinary medicines for a wide range of systemic infections caused by the susceptible bacteria. So in the case of both humans and other thing, in veterinary, this is very popular. Of course, the human use still for the dressing up of the wound, especially the wound caused during the accident, etc., are still treated by the streptopenicillin. Then they are also used topically in case of the eye, ear, and skin to prevent the local infections. Yes, that's also one of the important things. So they are also used topically on eye, ear, and skin. Then intramammary administration of the penicillin, like amoxicillin and the fluoxacillin, it is very widely used to treat bovine mastitis, especially in the subclinical stage. But in case of acute mastitis, it should not be used. It is somehow not indicated, acute mastitis. Then, coming to the first category, that is the narrow spectrum penicillins. So these are the narrow spectrum penicillins. So among these things, narrow spectrum, beta-lactam is sensitive penicillins. That's we have categorized yesterday. And among these things, the narrow spectrum beta-lactam is sensitive penicillins include naturally occurring penicillin G in its various pharmacological forms and few biosynthetic acid stable penicillins such as the Penicillin V or phenoxymethyl penicillin and the phenicillin. So these are all the acid resistant penicillins. So these are the narrow spectrum, means they are effective only against the gram positive bacteria but not against the gram negative bacteria. So the semi-synthetic penicillins are produced by the incorporation of a specific precursor in the mold cultures, example penicillin V. So this is made by the modification of penicillin G or 6-amino penicillin. So the semi-synthetic, because from the natural origin, it is very difficult to get the required quantity of the penicillin, and either we have to go for the complete synthetic or fully synthetic or semi-synthetic method. Especially the semi-synthetic method is adopted, then the specific precursor are added to the molds, then the penicillin is obtained. And penicillins of this group are active against mainly the gram positive bacteria, and all the penicillins are susceptible to beta-lactamase enzyme, which is secreted by the bacteria, because many of the bacteria do secrete especially the penicillinase enzyme and cause the beta-lactamase ring to be open. And several natural penicillins like the penicillin F, penicillin G, K, O, X are studied by early investigator, but only the penicillin G is used clinically. And penicillin V is a variant of the penicillin, but it is orally acting penicillin. Coming to the first agent, that is the penicillin G, it's also called as the benzyl penicillin. And it's a natural penicillin obtained from the fermentation of the mold Penicillium chrysogenum. So please remember that the Penicillium chrysogenum is going to yield the benzyl penicillin or the penicillin G. So this is a natural penicillin, means directly it is obtained from the mold, and it was the first penicillin clinically used and still remains an important and useful antimicrobial or antibacterial drug. So, of course, it is introduced in 1928 and 1947. The wide use started, and it's available commercially as sodium, penicillin G sodium, penicillin G potassium, procaine penicillin, benzathine penicillin, etc. And it vary in solubility, hence the duration of the action. The procaine penicillin G is also available in combination with the benzathine penicillin. So the penicillin G is inactivated by gastric acid, so it is not administered orally. That's need to be important. But all the penicillins are these such natural penicillins are inactivated by the beta-lactam is secreted by the bacteria. So penicillin G is such a rather unstable acid, but its salts are stable and used clinically. That's the sodium penicillin or penicillin G sodium. So penicillin G sodium or the benzyl penicillin potassium are soluble in water, while the procaine penicillin and benzathine penicillin are less soluble and very less soluble, especially in case of the water. So they form a turbid solution, means white solution, whereas the penicillin G sodium produces a crystal clear solution. The term crystalline penicillin or crystalline G penicillin is often used as a synonym for either sodium penicillin or the potassium penicillin. They are called as the crystalline form. The procaine and benzathine salts of the penicillin G are called as the depot penicillin on parental administration. They are the penicillin depots. So the thing is, why they are called as the depot is they slowly release the free penicillin G into the circulation, especially maintaining the effective concentrations against the susceptible bacteria for a long period. This is one of the characteristics. The prolonged exposure of the crystalline penicillin G to the water promote the hydrolysis, especially the prolonged exposure. Then the potency of the penicillin G is usually expressed in terms of the units. So always penicillin is also expressed in the units. So what are all the other drugs that are expressed in the units are the number one, the insulin is also expressed in the units, and some of the hormones like the LH hormone is also expressed in the units. So the international units or IU of the penicillin is amount of activity present in 0.06 microgram of the crystalline sodium salt of the penicillin. So please remember this particular thing. Once again, I am telling the international unit means one international unit of the penicillin is the amount of activity present in 0.06 microgram of the crystalline sodium of the penicillin G. That's why it is one international unit. So 1 milligram of the pure penicillin sodium, so it is having 1667 units of the penicillin. So if you weigh 1 milligram of penicillin, then it is equivalent to 1667 unit. Whereas the 1 milligram of pure penicillin G potassium sodium, it's 1667. Whereas the potassium, it is 1595 of unit. And the 1 milligram of the procaine penicillin equivalent to 1050 units. And 1 milligram of pure penicillin G benzathine is equivalent to 100-272. Many times, both of these are frequently asked the questions, especially in case of all the exams, including ICAR or any other exam. So 1 milligram of the pure penicillin G sodium is equivalent to 1667, potassium 1595, procaine 1050, then the benzathine 1272. Please remember this numericals. The dosage of antibacterial potency of chemisynthetic penicillins are expressed in terms of the weight, especially 10,000 to 20,000 international units per kg body weight. So antibacterial spectrum of the penicillin G is a narrow spectrum, and it's only effective against the gram-positive, not at all effective against the gram-negative bacteria. So the important organisms susceptible to natural penicillin G include the gram-positive aerobes like the Staphylococcus, then Streptococcus, Actinomyces, Erysipelathrix rhiziopathiae, causing the erysipelas in case of the pigs, Bacillus anthracis, which causes the anthrax, and the Staphylococcus and Streptococcus both are causing the severe mastitis in case of the cattle. And most aerobic bacteria like the anaerobic bacteria like the Clostridium and certain bacterioid species are also sensitive to the penicillin. So sometimes the Clostridium showi, especially which Clostridium perfringens, which are all causing the black waters, they're highly susceptible as on date also to the penicillin is concerned. The natural penicillin also affects the gram-negative aerobes such as the Haemophilus, which is causing the gonorrhea, the Pasteurella multocida or the Pasteurella species, which is causing the hemorrhagic septicemia, leptospirosis in case of the cattle and all the other animals, and some of the actinobacillus species, which is causing the wooden tongue, and also actinomycosis, which is causing the lumpy jaw. All these are treated by penicillin. So the list of the disease, important disease is number 1, the penicillin is effective against the anthrax. Then it is also effective against the tetanus, the Clostridium. Then also it is effective against the lumpy jaw, that's actinomycosis bovis, and also the wooden tongue, actinobacillus. Whereas also it's a very specific drug of choice for the leptospirosis. Then many strains of the penicillin G are sensitive till the what you call as the resistance to it. As on the date, many species of the bacteria have developed the resistance, and the penicillin G, also other penicillin, is not effective against the rickettsia, especially the ehrlichiosis or the diseases like anaplasmosis, etc. They are not effective against by this particular penicillin. And also the mycobacterium, then the fungi, the virus and protozoa, they are not susceptible. So the bacterium resistance penicillin is usually due to the elaboration of the beta-lactamase ring or the penicillinase, and is essentially similar to that of the general mechanism what we have discussed earlier, especially the beta-lactam ring will be open, and also the efflux pump will be acting, and there is a plasmid-mediated resistance. And coming to the kinetics of the penicillin G, so it is orally erratically absorbed, and GI tract, it is not absorbed properly because it is destroyed by the gastric juice before it reaches the duodenum. And most of the drugs are absorbed in the duodenum and lower part of the intestine, but it will not reach the duodenum at all. So if given in the food, absorption rate and extent may further, it is decreased. So the absorption is more in case of young animals than the old animals because the lower gastric acidity. So if it is used orally, penicillin must be given in the empty stomach. Whereas the penicillin G potassium and penicillin G sodium salts are rapidly absorbed after IM or subcutaneous administration, and give the peak plasma concentration within 20 to 30 minutes after the injection. Whereas the intravenous injection may occasionally be required in certain life-threatening infections like especially the black waters. Then, whereas the penicillin G is given as sodium or potassium salt by very slow IV infusion. Especially in cattle, nothing to worry about the allergic reactions. We can administer the required quantity of the penicillin without any fear. And the depot preparations of the penicillin like the procaine penicillin, the benzathine penicillin, or they are also called as the procaine or benzathine penicillin G. So they are slowly absorbed after the intramuscular injection. The therapeutic blood level of the penicillin will be attained after 2 to 3 hours. The penicillin administration, and it's maintained for 24 hours. So once in 24 hours injection is sufficient. The blood levels after benzathine penicillin administration may be achieved more slowly, but are maintained up to 7 days or more after a single injection. Whereas the depot salts of the penicillin G, particularly the procaine penicillin, are not administered by IV route because of the adverse effect on the cardiac conductions. Especially procaine is having the adverse effect on the heart. So suddenly it may stop the heart functioning. So after absorption, penicillin G is widely distributed throughout the body, tissues and fluids, with exception of the CSF, brain, milk and joints. So it is not going to cause the high concentration in cerebrospinal fluid, the brain, and also on the heart, especially on the heart. So it does not diffuse through the blood-brain barrier and useless in case of meningitis, unless there is a meningitis. And penicillin G is largely excreted unchanged in the urine. See, 99% or above 80 to 90% is expressed unchanged in the urine, and especially after glomerular filtration and active tubular secretion. And some part of the penicillin is metabolized to penicilloic acid. So that is responsible for the further allergy, especially. And elimination half-life of the penicillin in most of the species is very short. It is very fastly excreted. That's 0.5 to 1 hour. And few things to remember is the oral administration. It is hampered and it is widely distributed through all the body fluids except the cerebrospinal fluid. In case of milk also it will not come. So we see that the penicillin G sodium, it is not causing the allergy after drinking the milk. Coming to the contraindications of the penicillins, like the penicillin G is used in all domestic animals for the treatment of the infections caused by the gram-positive bacteria and few gram-negative bacteria and non-penicillin producing pathogens. So penicillin G, either alone or in combination with other antimicrobials such as streptomycin, remains the drug of choice for variety of the susceptible infections, of course. So streptopenicillin, or the oldest trade name tricristicin, or is one of the most popular preparations till today in the veterinary practice and very commonly used for the treatment of varieties of the bacterial diseases, like the number 1 is actinomycosis, lumpy jaw, this leptospirosis, and also the black waters. It's still the drug of choice. So the penicillin G is also used prophylactically before the procedures like the surgical operations, endoscopies, and catheterization, which are likely to cause the bacterial infections, especially. So the patient is prior administered with the penicillin G, and later all these diagnostic procedures will be done. So some of the important organisms which are susceptible to the penicillin G are the actinomycosis species, which is causing the lumpy jaw, and sometimes the mastitis. Whereas it is also a specific drug in case of the anthrax, that is the Bacillus anthracis. Of course, the anthrax is a very deadly disease, but it is cured by the penicillins if you administer in a proper time. And also the Clostridium is a species which causes the black waters, botulinum, brachy, lamb dysentery. That's also the pulpy kidney disease, then the tetanus. All these are caused by the Clostridium. Hence, in such a disease, it may be used. Especially, it's a drug of choice for the black water. And the Corynebacterium species like the Corynebacterium renale, which causes the kidney infection and also the upper respiratory tract infections like the bronchopneumonia and also the mastitis, then polynephritis, and also the cystitis. So this is a drug. Then the leptospira, which causes abortion and nephritis, especially in case of cattle, need to be treated with the penicillin. And the streptococcus infections, that's the mastitis and sometimes endocarditis, then the strangles, especially in case of horses, then septicemia, then the otitis, metritis, and also the tonsillitis. So, in the variety of these different bacteria, actomycetes, bacillus, clostridia, etc., these are all the important bacteria. Apart from this one, so many other bacteria are also present which are sensitive to the penicillin. Then the dose of this particular penicillin, please remember the dose of the penicillin G, sodium or potassium, it is 20,000 units per kg body weight. So the route of the administration is IM, IC or subcutaneous or sometimes very slow IV whenever it is required. And the dose interval is 4 to 6 times a daily. So especially after surgery, this type of the dose is always used, 20,000 units, that is per kg body weight, IM or SC, or 4 to 6 times, but nobody is following this particular. Then the 40,000 units per kg, especially administered orally on empty stomach 4 times daily. Whereas cattle, in case of mastitis, it is up to that is 3 lakhs units per quarter intramammary infusions. So 3 infusions are required per day, and the 24 to 48 hours once it need to be administered repeated. That's why in case of cattle, still the streptomycin penicillin is also one of the oldest preparation. That's the Penicillin SH is there of the Sarabai company, and even though the company is not there, still the combination is very, very popular. But the thing is, most of the microorganisms are nowadays maybe the Staphylococcus or the Streptococcus, they are resistant now. Then the procaine penicillin, the dosage is same, the 20,000 units. So please remember that the dosage range from 10,000 to 20,000 international units per kg body weight 1 to 2 times daily until the infection is cured. So horses also 20,000 to 1 lakh units per kg, IM 2 times, whereas the swine 40,000 units per kg. Then the benzathine penicillin, of course, the dogs 40,000 to 50,000 units per kg. Then also the horses 50,000 international units per kg. Then the phenoxymethylpenicillin or the penicillin V is a variant of penicillin G obtained by adding 2-phenoxyethyl to the penicillium. That's the culture using the yeast autolysis, a source of the nitrogen. So the crystalline penicillin, of course, the dose is very same. Very same. Then the benzathine penicillin, like dogs and cats, it is the 40,000 units. So always remember the dose of the penicillin, 10,000 to 50,000 international per kg body weight, IM or subcutaneous. That's the dose range. So either 1 or 2,000 international will not make much difference. Then the acid resistance penicillins. So the first agent is the penicillin V or the phenoxymethyl penicillin. It is called as the acid resistant. So it's a variant of penicillin G obtained by adding 2-phenoxyethanol to penicillin culture using yeast autolysate as a source of the nitrogen. So the phenoxymethyl group of the penicillin imparts very acid stability on oral administration. Then it has a similar antibacterial spectrum to the penicillin G, but it is less active. So whenever it's not possible that the penicillin need to be administered injection, then this route should be followed. So after oral administration, the phenoxymethyl penicillin is better absorbed than the penicillin G, but absorption is highly unpredictable because the presence of the food, etc., they hamper a lot. That's why the systemic severe infections should not be treated with the penicillin V or phenoxymethyl penicillin. So in veterinary medicine, the phenoxymethyl penicillin is used especially in case of the GI treatment or infections. So it is not suitable for the treatment of the bacteremia or severe infections because of its high minimal bactericidal concentration. So it has got very high bactericidal MBC. So the small dose is not sufficient, and variable plasma drug concentration of larger doses given at the potassium sparing diuretics can also cause the hyperkalemia. Means if you use these drugs with that of the potassium sparing diuretics like the spironolactone can cause the hyperkalemia. So it is used as the penicillin V potassium, and the potency of the penicillin V potassium is usually expressed in terms of the weight in milligram of the penicillin V, and the penicillin V unit may also be used. That 1 milligram of the penicillin V is equal to 1300 or to 1610 units. That's the United States pharmacopoeia. And the dose of this thing is, it is expressed in milligram per kg, 5 to 10 milligram versus 4 to 60 milligram orally for 3 times. In swine, it is the 200 gram per ton of the feed. So of course, nowadays this penicillin is very less commonly used because of the availability of other broad spectrum antimicrobial drugs. Then the phenicillin is also called as phenoxyethyl penicillin. Phenoxymethyl penicillin is, of course, this is the first clinically useful true semisynthetic penicillin produced by the chemical modification of 6-aminopenicillinic acid. So its action is very similar to that of the penicillin V, but it's less used clinically nowadays. The reason being, once upon a time these were all used very commonly, but nowadays they are being avoided because of the availability of the newer and modern drugs. So this is the structure of the acid-resistant penicillins. We can see that the penicillin G sodium is, this is the structure, penicillin G sodium, and the acid-resistant penicillin like phenoxymethyl and phenoxyethyl penicillin. So methyl group here, phenoxymethyl group, this CH3 group is there, and of course this makes the acid resistance property of this particular penicillin. So phenoxypenicillin V is the phenoxymethyl penicillins, and the chemical structures are looking like this. They also contains the thiazolidine ring and the beta-lactam ring, which are joined to a side chain proteins. Side chain, the